I appreciate very much the opportunity to share my perspective, having lived in Oregon for 40 years. So I have been here both before and after the passage of assisted suicide, and it's radically and fundamentally changed the perspective for end-of-life care in Oregon. And it's in my mind, it's not for the better. You know, after 27 years, we now have in Oregon, supposedly the bellwether state, we have 9 other states that have legalized assisted suicide, and one, the judge in Montana, ruled that it was okay, a doctor would have a defense. But what I want to share is that 40 states have not passed it. In fact, 38 states have actually strengthened their laws against assisted suicide, 4 of them just in the last year. So I think what I'm trying to say is that many states have looked deeply at the Oregon data and have found that it's not what it is cracked up to be. This one came out in the papers, though. A 64-year-old retired school bus driver, Barbara Wagner, she had metastatic lung cancer, was in remission, it recurred. Her oncologist wanted to prescribe Tarceva, a drug that would have given her a 46% increased chance of being alive in a year. The Oregon Health Plan is now covering many of these people, and they will pay 100% for assisted suicide, but they wouldn't pay for the chemotherapy. The Oregon Health Program medical director said it's necessary to point out options that are available, and essentially assisted suicide could be considered as, quote, comfort care, end quote. And this is the idea that the solution to suffering now in Oregon is to end the life of the sufferer. So who is asking? There's a picture of Kate Cheney and her daughter, Erica. Kate Cheney is a survivor of the Holocaust. She had some mild dementia. As she went to a psychiatrist at my former institution, Oregon Health and Science University, Dr. Ganzini, the psychiatrist, said, it isn't really clear who's asking for the assisted suicide. And her quote was, the daughter, Erica, seems to be coercive, end quote. She went to a second doctor, a psychologist. He didn't use the word coercive, but he also wouldn't sign off on the suicide. She then shopped for a third doctor in the Kaiser Foundation healthcare system. And it was Dr. Goodwin who said she's a candidate for it. 2 weeks later, she's dead. Who profits? This is a case in Bend, Oregon. Thomas Middleton, he had Lou Gehrig's disease. He moved in with Tammy Sawyer, who was acting as a caretaker. He named Sawyer as a state trustee, told her to put the home in a trust and not sell it until the market went up. 2 days after her death, she deposited his money into her own account and put the house up for sale, didn't follow his wishes. She was indicted for criminal mistreatment and aggravated theft. You can say, well, she got what was supposed to happen. Well, that would have never come to light had it not been for other nefarious activities by Tammy, because the whole thing is under a shroud of secrecy, as I said. So there is a slippery slope. The eligibility is extended to our efforts to try to pass it, bills to extend it to 12 months, includes now starvation for demented patients. Ingest now, a bill was put forth to include IV injection. Again, it's inefficient to take overdoses. We have injection for children in Belgium, psychiatric care centers allowing euthanasia for mentally ill. Now the disabled are at risk in the Netherlands, and those who feel like they completed a life are eligible as well. The Secretary of the College of Medicine in Quebec asked the following question: if the goal of euthanasia on demand is based on a right, are we still talking about medical aid in dying, or simply aid in dying? And what then would the medical profession have to do with it? So it's an inherent conflict of interest for the medical profession. It's a corruption of the integrity of palliative care and hospice. And if the so-called death with dignity is embraced by a society, the activity should be performed by some entity outside of the medical profession to avoid that inherent conflict of interest. I often say it's a little bit like a lawyer or a barrister in your country protecting the defense interests and then walking across the aisle and actually helping the prosecution. And if you don't think that's a conflict of interest, it's also acting as the judge deciding which lawyer has the better argument. And worse yet, it's the executioner in a capital punishment case. So I ask you to consider this and not make Oregon's mistake. Thank you.